Care of the newborn and mother. Mothers require emotional support, guidance, and practical assistance in the days following delivery. Proper care for both the mother and the newborn during this period is essential to prevent complications and promote overall well-being. Ideally, all pregnant women should receive comprehensive counselling on newborn care during their antenatal visits. This enables them to be well prepared to meet the demands of motherhood. After delivery, most mothers spend only a short time in the hospital. During this time, they need time to bond with their baby, building an emotional connection, rest, recovery from the physical demands of childbirth, practical guidance, learning essential care routines for their newborn. Postnatal care guidelines. The postnatal environment. The environment should be calm, clean, and warm, ensuring comfort and safety for both mother and baby. Adequate ventilation and hygiene practices should be maintained to reduce the risk of infections. Breastfeeding. Breastfeeding should start within the first hour of birth to ensure the baby receives colostrum, which is rich in antibodies and nutrients. Feed the baby on demand, generally every 2 to 3 hours. Ensure both breasts are used to maintain milk production. Proper latch techniques can prevent nipple soreness and ensure effective feeding. Signs of a good latch. Baby's mouth covers most of the areola, not just the nipple. No pain during breastfeeding. Baby shows rhythmic sucking and swallowing sounds. Hygiene practices. Wash hands before handling the baby or breastfeeding. Sterilize feeding bottles and pacifiers if used. Ensure the baby's clothes and bedding are clean and changed regularly. Daily care for the baby. Warmth. Dress the baby in layers suitable for the room temperature. Use skin-to-skin contact to maintain warmth if the baby's body feels cold. Umbilical cord care. Keep the stump clean and dry. Avoid covering it with a diaper. Clean with methylated spirit or chlorhexidine during every diaper change. Look for signs of infection such as redness, swelling, or foul smell. Baby bathing. Sponge baths are recommended until the umbilical stump falls off. Use lukewarm water and a mild baby soap. Dry the baby thoroughly and wrap them in a warm towel immediately after the bath. Clothing for the baby. Dress the baby in one more layer than what an adult feels comfortable wearing. Cover the baby's head and feet to retain warmth. Avoid overly tight clothing to ensure proper circulation. Diapering. Change diapers frequently to prevent rashes. Apply a protective barrier cream if necessary. Allow the baby's skin to air dry during changes. Special procedures and postnatal care. Sitz bath for mothers. A sitz bath can reduce pain, swelling, and promote healing of the perineal area, especially after episiotomy or vaginal tearing. Use warm water mixed with antiseptic solutions if advised by a healthcare provider. Care of suture sites for cesarean or episiotomy. Keep the area clean and dry. Avoid heavy lifting or strenuous activities. Monitor for danger signs such as swelling, redness, or heat around the wound, pus or foul-smelling discharge, persistent pain or fever. Circumcision and ear piercing. Care of circumcised penis. Keep the area clean and dry. Wash with warm water. Avoid soaps or wipes with alcohol. Do not forcefully remove the plastibell. Allow it to fall off naturally. Watch for signs of infection such as prolonged bleeding or pus. Ear piercing female babies. Clean the pierced area with methylated spirit daily. Ensure earrings are lightweight and securely fastened. Avoid removing earrings for at least 6 weeks. Recognizing danger signs for the baby: fever above 38 degrees Celsius or persistent low temperature below 36 degrees Celsius, refusal to feed or frequent vomiting, diarrhea or fewer than 6 wet diapers in 24 hours, difficulty breathing or bluish discoloration of the lips, jaundice, yellowing of the skin or eyes, worsening after the 3rd day. For the mother, excessive bleeding or soaking more than 1 pad per hour, severe abdominal pain or cramping, persistent headaches or blurry vision, signs of infection at the incision site or perineal tears. Bonding and handling tips. Bonding with your baby. Engage in skin-to-skin contact often as it helps regulate the baby's temperature, heartbeat and breathing. Talk, sing and coo to your baby. Babies are soothed by familiar voices. Safe handling. Always support the baby's head and neck while carrying or laying them down. Never shake the baby, it can cause serious injury. Use a firm grip when bathing or changing the baby. Swaddling. Swaddling helps newborns feel secure and limits their startle reflex. Avoid tight swaddling that restricts leg movement to prevent hip dysplasia. Feeding and burping basics. Newborns should be fed every 2 to 3 hours. For breastfed babies, ensure they feed for 10 to 15 minutes on each breast. Bottle-fed babies typically consume 60 to 90 milliliters per feeding. Burp the baby after every feed to prevent gas buildup. How to burp. 1. Hold the baby upright against your chest with their head resting on your shoulder. 2. Gently pat or rub their back until they burp. Sleeping basics. Newborns sleep 16 to 18 hours a day, often in short stretches of 2 to 4 hours. Always place the baby on their back to sleep to reduce the risk of sudden infant death syndrome, SIDS. Use a firm mattress without pillows, toys, or loose bedding in the crib. Final reminders. Mothers and caregivers should remain calm and confident while caring for the baby. Always consult a healthcare provider if there are signs of complications. Regular checkups are important for monitoring the health of both mother and baby. This comprehensive guide ensures that both mother and baby are well cared for during the critical postnatal period, fostering a healthy and happy start to their journey together.